I'm an ophthalmologist by accident. For all the people who don't know, I wanted to be an orthopedic surgeon.
Who has choose ophthalmology as a career, sir, what advice you would give them so that they can chart out their career?
All the youngsters can have education, skill set, qualifications, but they need to have that attitude.
What is your leadership style?
The first thing of a leader is he has to learn to pick up the right people.
Getting the right size for Phakic IOLs, which is a sir challenge.
Started actually seeing what size of lens we put, what were the measurements we took, what was the end result.
So sir, where did you start learning the DJ?
Again, as I said, when life throws a situation at you, make something out of it. I had an accident and I damaged my back.
Welcome to the second episode of Eyeconic Journeys. In today's episode, our special guest is Dr. Kamal Kapoor, who is co-founder and medical director of Sharpsight Eye Hospitals. In this episode, we had a discussion with Dr. Kamal on how he manages group of hospitals and surgery, how he manages complications during surgery, and his leadership style, which is able to run that group of hospitals. Then we had discussion regarding a study in which he was a part in getting their ICL sizing right. So without wasting any single minute, let's welcome him on this podcast.
I'm an ophthalmologist by accident. For all the people who don't know, I wanted to be an orthopedic surgeon. And I somehow missed being an orthopedic surgeon because I had 1 mark less than the person before me. And I never liked ophthalmology. I was not fond of ophthalmology because in my younger days, I used to be a weight trainer and I had biceps of 16, 17 inches. So I never imagined myself to be operating a small eye. Anyway, I joined ophthalmology, but I was never taking interest. Till one day, by accident, one of my senior professors handed me to complete a case because he had to rush for an emergency. He did not ask me whether I have ever used the instrument or microscope or not. I was in my first year post-graduation. I had just seen him operate. So I did whatever I could and I closed the case. Next day changed my life because next day he called me to his room and he said, "Have you worked as a house job in ophthalmology before?" I said, "No, sir, I'm just a first year PG." "Have you ever used the microscope before?" I said, "No, I've just seen you how you operate." So he said, "Son, let me tell you, you are gifted, you have good surgical hands, and from what I came to know about you when I asked the other professors, you are not taking any interest in ophthalmology, you are wasting your life, you will do very well in ophthalmology." So the next day, a new Dr. Kamal went to the PG college and life changed after.
Life changed.
So the lesson for your viewers is, don't wait for a ball which has a sixer in it. Hit for a sixer in every ball which comes. Make the best of whatever opportunity your life throws at you and you will see. Most of us keep waiting for one opportunity till we get something what our passion is. I think you can make anything as your passion provided you have the passion in you.
So sir, you became ophthalmologist by an accident. You said this. So, sir, if you were not an ophthalmologist, what career profession you would have chosen?
Again, this is a very interesting situation. I would have been, my father thought I would be going to IIT because my first love is physics and electronics. As a hobby, I am still known to repair machines. I open my Phaco machines and I repair them. Even when I go home, my best pastime is I open broken things, microwave ovens, televisions, camcorders, DVDs. I open them, I repair them. That's my pastime. So at my home, if there's any electronic thing which is broken, it is a prize for me because I don't want to throw it, I want to repair it. So even if I can't repair it, I learn it. So I think I would have been an electronics engineer or a physicist. And that is one thing which probably helps me in the way I do my profession also. I use a lot of electronics and physics in the way I operate, in the way I understand machines, in the way I understand optics, IOLs. So that gives me a little edge in my profession when I use that passion of mine in the profession of mine.
So, sir, the first time I heard you playing DJ was at Punjab Ophthalmic Conference, and the second time I heard you playing at IIRSI Amritsar. Sir, you played DJ like a professional. Really, it was the one of the best moments when we enjoyed a lot. So, sir, where did you start learning the DJ?
Again, as I said, when life throws a situation at you, make something out of it. I had an accident and I damaged my back. So I was on a bed rest for 6 months. So during that time, I designed a special table for me, which because I could not move, I designed a table with a carpenter. So that table would be like this and I could work on a laptop. And that's the time I learned DJing and sound engineering, lying down on the bed while I was recuperating from a back surgery. So what I've seen in life is I don't let bad things stop me. I utilize it to pick up something and not waste the time. So during my COVID, I learned some softwares, I learned video editing, animations. I was sitting at home. So I guess all of us have it. Let me tell, all of us have that special flair in us. It's just that we let other people tell us that you can't do this. But the problem is we listen to people because they couldn't do it. So we don't try. So that's how I learned DJing while I was sick.
And sir, with ophthalmologists, you took a leap into entrepreneurship as well. And sir, you are running a successful chain of hospitals as well. So sir, with entrepreneurship, sir, leadership came. So sir, what is your leadership style? So sir, with that, you can effectively manage your team as well to move forward in the common vision.
I think this is a very, very interesting question. I think again, I became an entrepreneur by default. It was not by design. I was very happy being a doctor, a simple ophthalmic surgeon, but doing good work. Destiny and providence kept putting people around me who were like-minded, but they had the skill set of starting a business. And I had a skill set of technical, clinical excellence, capacity building, mentoring surgeons, quality, clinical quality. So I was very lucky to have team around me, which somehow put their dream into me and my clinical excellence into them, and the journey started. So the skill set which I actually feel is very, very helpful for all of us is, first of all, most of us don't want to delegate. We want to do everything ourselves. The first thing of a leader is he has to learn to pick up the right people. I may not know everything about everything, but if I know how to pick up the right person who knows everything about that thing, I'll be a leader. Picking up the right people for the right job is a skill.
Is a skill.
And then once you know they can do it, trusting them to even make a mistake is another skill set. If they make a mistake, it's fine. As long as it's an act of omission, it's okay. But if it's an act of commission, कोई जान के गलती कर रहा है, सोच समझ के गलती कर रहा है, वो excusable नहीं है. मगर by mistake हो रहा है, तो we all make mistakes. In fact, the only person who doesn't make a mistake is one who doesn't try.
Doesn't try.
Another good thing is warmth, camaraderie, treating everybody with respect, treating everybody as your equal, irrespective of whatever post they hold. Making micro leaders. All these things I think are important. They are very important to run a team. So when there is something good which happens, I applaud and appreciate in open in front of everybody. But if there's a mistake, I call the person one-to-one and talk. So whenever there is something good which happens, we make sure that everybody claps for that person in a group. But if there's a mistake, I call the person to my room, have one-to-one discussion. So that mistake is not, the person doesn't feel ridiculed or insulted in front of the whole team. That is another thing which I feel is very, very useful, because when we are in a group, sometimes we forget, we reprimand people, We say bad things to them in front of other people. And that is something which nobody forgets. So praise in front of people, but criticize in solitary.
Private. So that's very beautiful advice. So sir, if you were 25 years of age, sir, what advice you would give to yourself?
If I was 25 years of age, there are a lot of things I wouldn't have done what I've done. There are a lot of mistakes I made in my professional associations, choices, as I went along, business decisions, regretted a lot of business decisions. But when I look back, I would have done the same things again. Because everybody can be wise when you look back. So the way I look at life is, if everybody is given the same situation and same circumstance, suppose the circumstance I had 25 years ago, the same circumstances, I would have taken the same decision. Why regret it? Because everybody in a given situation takes the best possible decision of the option available to them. Nobody takes the second best. I took the best, whatever I could understand. Retrospectively, I can say, maybe it was a mistake. But at that point, 25 years back again, I would have done the same thing because I was not aware. In fact, those experiences have made me richer, more complete, more fulfilled, more rounded edges.
More passionate.
More
towards
passionate. And celebrating each moment, because I know that when a mistake happens, you can rise up again. That gives you more confidence. If a person has just got success all his life, he cannot handle letdowns. But if you had ups, downs, then you know that come what may, I will survive because I've survived all these years.
So one thing I admire about you is you have done so many things, and whatever you do, you try to go for perfectionism. When you play DJ, we don't feel like somebody
Who's a
amateur
doctor.
is playing DJ. It's like a professional is playing DJ. You're a surgeon, a great surgeon. You are giving talks internationally and nationally. And even, sir, what I've heard about you, you were a Asia Pacific
Yes, scientific advisory
scientific advisory board also for some of the
board. Yeah,
manufacturers.
multinational.
Yeah. So, sir, that's what I admire about you a lot. So, sir, for a young PG student who has choose ophthalmology as a career, sir, what advice you would give them so they can chart out their career?
I guess, there are different categories how you chart out your professional career. One is an innate talent you're born with. You're born with a talent. Second is an acquired skill set. And third is the experience. You need all these three to be successful professionally. And the topping is your attitude. Aptitude is something what you're born with. I have an aptitude of a scientist. I have an aptitude of a physicist. I was born with that. The credit goes to God. But if I can sustain an attitude to learn something what I don't know, is the attitude. If I can actually think that, okay, this is the problem, but I will be able to solve it. No matter what happens, I will survive. That is an attitude. So a lot of youngsters mix education, knowledge and skill and miss out on the attitude. Without the attitude is the final cream on the cake. Having the right amount of attitude of being successful, not giving up, putting in your 100% is something which makes a person go to the next level. So all the youngsters can have education, skill set, qualifications, but they need to have that attitude to go through. That's what makes eventually. So all the top eye surgeons, all top successful professional people you will see have that X factor, attitude.
So, sir, how can one develop attitude?
I guess that's where mentoring happens. That's where experience happens. If you get to work with a person who is a go-getter, so it opens your mind. It is like, how does a little child jump into the water when the water swimming pool is unknown to him because he sees his father jump into it. He knows my father can do it, I can do it. He may not know how to swim because the child is innocent. Similarly, our mind opens up by seeing things around us. So when you see a lot of things happening, the youngster generation has got a lot more plus points because we learned the way we learned was by simply seeing VHS videos. I remember I used to import videos from USA and Europe from my sisters of some surgeons, and all night I would just watch videos. That's how I learned it. But today's youngsters have so many avenues. They have mentors, they have machines, everything is available. So that attitude comes when you see people around you do something and you know it is doable. It's once you see that somebody's done it, then for the second person it becomes easier. The third becomes more easier. But you need to have an open mind to have an attitude. But if you actually feel that, okay, I cannot do this, then you will not go beyond that.
So, sir, first statement says eye surgery can make me go blind. Is it a fact or a fear?
It's absolutely a myth. Let me tell you, the most performed surgery in the world is an eye surgery. The most performed surgery on any organ of the human body is the eye surgery. Because cataract, everybody will have. I will have, you will have, my children will have, my parents had. And everybody will have the surgery twice, not once. So you can imagine how many millions and millions of eye surgeries are done. So if this was a surgery which had such devastating results, it would not happen. So it is a myth that eye surgery will make you go blind. Yes, complications do happen. But the way I describe a good surgeon is the one not who doesn't have complications. In my definition, an excellent surgeon, you know, my teacher used to say you could be a good surgeon and you could be an excellent surgeon. So I said, how? He said a good surgeon will do a good surgery and give good results. But an excellent surgeon will even handle a bad surgery and give good results. So that is the difference. So a lot of people are dwelling in this zone. Complications can happen. The best of driver may have an accident. But if he's a crafty and a trained driver, he will get away with least damage to the car and the passengers. So that is what happens. So eye surgery is a very safe surgery. Most performed surgery in the world. We do thousands each month. Patients are excellent. You do have complications, but they're all manageable.
Sir, there is one more thing patients believe is cataract surgery is painful and takes months to recover.
I think this is one of the biggest myths. I am, as you know, that we do most of the surgeries without injection. I'm a 100% injection-free surgeon. We just put drops and the eye is absolutely painless. Surgery in good surgeon's hand can be over in 8 to 10 minutes. Most of my surgeries are over under 3 minutes. So surgeries over under 3 minutes. The effect of the medicine lasts you around 30-35 minutes. All we do is we give a small patch. You take the patch after 1 hour, go watch television at night. So if your surgery has been uneventful, it was a simple surgery, no complication, not a complicated case, the patient is joining work within 1 or 2 days. Only restriction probably is splashing water in your eyes and rubbing your eyes with cloth or something for 4 to 5 days. After 6-7 days, you're back bathing, shaving, shampoo, dye, hair color, whatever, everything you know.
So, using eye drops for too long damages eyesight.
It is right and it could be wrong, both. It is a partial truth in this myth. There are some drops which should not be used beyond the recommended dosage as per your doctor. Some of them are steroids. A lot of patients are walking up to the chemist and asking for a drop, which the chemist uses his own discretion to give the patient, and the patient continues to use them. But these drops will cause harm to you. They will cause damage to you. Some of the drops can make you permanently blind. They are known to cause cataract. They are known to cause glaucoma. They are also known to cause corneal ulcers. All three are blinding conditions. So, using drops without prescription, beyond the time of prescription, can cause damage. But if the drops are recommended by your doctor and have been given for a time duration, you are absolutely okay in using them for as long as you want.
Okay. So now the next segment is there are a lot of misleading claims on Google. So sir, as we are using mobile phones every day, so sir, there are some common claims. So sir, first of the claim is staring at staring at a screen all day will make you go blind.
This is one of the biggest myths. I believe it was started by some media houses that some person went blind while watching a mobile phone. Now, nobody's been able to find out the truth or the reality behind it. There could be many reasons why it happened, but it was not the screen per se. Yes, excessive screen time can cause a lot of discomfort and problems for your patients, both at the eye level, physical level, psychological level. So it can, watching excess mobile phone, excess screen time can do 3 damages. 1 to your eye, 1 to your thought process, psychologically, and 3rd, physically. So let's start with physically. You're using a lot of mobile phone, you're bending your neck all the time,
Right.
you will get cervical spondylitis. So highest incidence of cervical spondylitis in youngsters, mobile phone. They get fibrosis of the wrist, holding the phone like this the whole day. The muscles get atrophied, there's fibrosis. Now let's come to the psychological part. A lot of children are getting addicted to mobile phones. So what is they're doing is they're getting attention deficit disorder, which means they are not able to sustain their attention for a long time in a class. They will not listen to anybody for long because the brains has a concept called dopamine receptors. Now, when you're switching a screen, immediate gratification. You don't like something, you change. You don't like something, you change. So the brain thinks it can change anything it doesn't like. But the real life is not that. You don't like a teacher, you still have to sit in the class. You don't like a subject, you have to go through, you have to give the exam. But the child's mindset changes. He does not want to do anything which he doesn't like. It creates agitation, loss of memory, loss of concentration, antisocial behavior. People are sitting on dining table, children are seeing their phone. They are not talking to the parents. So life skills are being lost.
Sir, even children are getting aggressive. Like
Absolutely.
if you take the mobile phone from them, they are getting
That's what I said.
Yeah.
So it causes aggression, psychological, psychosocial problems. And now come to the eyes. Mobile phones or screens may not make you blind, but they definitely can cause myopia in young children. Children, if they use a lot of mobile phone, will have minus power. Research has proven all over the world, children who are using excessive mobile phones and not playing outdoors will get glasses. And if they have glasses, the power will go up. Second thing which can happen with the mobile phone is dry eye. It's a very, very rampant thing. A lot of people who are using a lot of computers and screens, they get dry eyes. So the patient needs to blink very often. Their eyes hurt, they itch, they want to sleep, they're feeling sleepy all the time, burning of the eyes, not able to look at an object for a long time. This is again effect of dry eye on their eyes.
So sir, is a dry eye reversible or it is lifelong?
It can be reversible, but it's more of a lifestyle disease. So till the time you don't control your lifestyle, it will continue. You can continue to use medicines, but as it is, aging will cause dry eye. For a person who starts having dry eye at 10 years or 12 years of age, what happens to him when he reaches 40, 50? Because by normal 40, 50 patients will get some dry eyes because of aging. So these patients are going to be more problematic as time happens.
So sir, what are some of the common symptoms of dry eye?
Dry eye, one of the most common symptoms is itchy eyes, redness, watering, photophobia. They can't look at the light, their eyes hurt. Problems in driving at night, inability to look at a bright light. Even the wind or air will hurt your eyes because it dries your eyes. So when these patients are sitting under a fan or sitting in front of an air conditioner, their eyes will pain and be red. Now, when you tell a patient that you have a dry eye, the patient will say, "Doc Saab, my eyes are watering. Why are you saying it's a dry eye?" So it's an irony that a patient with dry eye will have watery eyes. The reason being, the eye needs lubrication. A patient approximately will blink 7,000 to 10,000 times a day. The reason for that is there is an oil secreted by a gland here called meibomian gland. And when you blink, the oil spreads all over the eye, keeps the eye lubricated. So when the gland goes weak, there is no oil in the eye and the eye needs lubrication. So water is the next best thing the eye can secrete because oil is not there. So the eye secretes more water to compensate for lack of oil.
Okay.
Evaporation of the tears are happening because there is no oil layer covering. So eye secretes more water, but there is no oil, the water evaporates. Eye secretes more water, no oil to save it from evaporating. So it's a vicious cycle.
So it's a cycle. So sir, there is one more claim: rinsing your eyes with water daily in the morning improves vision.
This is a myth, but yes, it's not a bad idea, especially in polluted cities where you get a lot of pollutants. Washing your eyes with clean, filtered, clean water is a good habit, but excessive washing will cause problems because it washes away your oil.
Oil, right.
It washes away your natural oil. So splashing water in your eyes once you come back from work, after you come back from polluted environment, it's absolutely okay.
So sir, sleeping with contact lenses occasionally is fine.
It is absolutely not fine at all. Of course, there is a half truth in it. There are some special kind of contact lenses which are called bandage lenses, or they are very high decay value lenses. There are some other lenses which are called ortho-K lenses, which are designed to be worn at night and you can continue that. But normal standard lenses, you should not sleep with them because they can cause permanent damage to your eye, cause corneal ulcers or damage to your cornea, because the cornea takes oxygen from the air. And if you put a contact lens on top of it and you close the lid when you sleep on top of it, the eye is not getting oxygen. So the eye can get damaged.
Okay. Sir, you were a part of the study which worked on getting the right size for Phakic IOLs, which is a challenge. So sir, what challenges were there and how did you overcome them?
See, I think, Satyam, the best part I'm blessed with is I'm blessed with numbers, patient numbers. I happen to be in an organization where we do huge numbers. I probably have one of the highest numbers of Phakic lenses probably in this part of the world. So that gave me an edge over my other counterparts. And secondly, having a bent of mind where I can probably think in a 3-dimension in my head and I can figure out things. So we started actually seeing what size of lens we put, what were the measurements we took, what was the end result. So when we started putting this data into a system, we started getting indicators. We started getting standard deviation curves. Okay, this is what works, this is what works. So we collaborated with the company and told them, okay, this is our experience, change the design here, you could do this, change the material slightly here, the foot plate should be like that. So just doing sheer numbers, observing them with an analytical mind, with the mind of a surgeon and a structural material engineer. Observing it, imagining what would this force be doing to this lens, why is it behaving like this, and putting the data back to the company and sitting together with them, we could crack that.
So sir, if someone wants to incorporate Phakic IOLs in their practice, sir, what is the step-by-step approach to ensure precision in ICL sizing?
See, Phakic lens sizing is actually an art and also a science. There are a lot of factors which are in the surgeon's domain of visibility, and there are a lot of factors which are not in the surgeon's domain of visibility. A lot of measurements are blind measurements, which means you are kind of measuring the outer surface of the eye, based on that interpolating the internal surface. But nature, as they say, is not perfect. Not human beings are not made in a factory. So you do get these outliers where things will not corroborate the way you do. So measurement of the outside usually corroborates with the measurement of the inside of the body, but sometimes it may not. So you could have surprises. So getting the Phakic lens right actually is all about measurements. Most important measurement, in my opinion, is measuring the HVID, the horizontal visible iris diameter, what some people may label it loosely as white to white. And it can have varying values. You could take a reading, it could be different. I could take a reading, it could be different. So the standardization is yet now coming in with a lot of new equipment, but still there could be some discrepancies in the way an image is taken. Some of these cameras are using infrared images. Now, infrared will never demarcate between brown, black, red. It will just give black and white. So if there are some blood vessels around the eye, there is a scar, the machine will miss it and take it as the standard measurement. So these outliers are there. So measuring pre-operative to get a good phakic IOL result is all the game of measurement. Surgery by itself is not a big deal. So it's having set number of protocols, what you would use to do the measurements. That's what works for surgeons. Otherwise, you need skills of a good phaco anterior segment surgeons. Surgery is not a big problem.
So, sir, it's like 90% of the work is done
Pre-operative.
pre-operative.
Phakic lens in my hands is around 1 minute 20 seconds, 1 minute 30 seconds. But there is 1 hour of workup required for that patient for me to do the surgery in 1 minute.
1 minute. So, sir, what is the patient selection criteria for the phakic IOLs?
Phakic IOLs have a lot of patient selection criteria. Number one is affordability, let's face it. Phakic lens is an expensive proposition, not all patients can afford it. Second is, there should be no other options available to the patient, like, since it's an expensive procedure, can the patient do something which could be less costly for the patient? Number two, having an anterior chamber depth of 2.8 millimeters. Now, anterior chamber depth is the distance between the endothelium of the cornea and the anterior surface of the crystalline lens of the eye. It has to be lowest of 2.8 millimeters. Secondly, having an angle, open angle. Thirdly, having a decent healthy cornea. Fourthly, gonioscopy showing open trabecular meshwork, not pigmented, no synechiae. Thirdly, there should be no abnormal, there is a concept called CLR. We were one of the first few people to describe CLR requirement for aberrant cases which were not behaving normally. We did that 10 years ago. So there are a lot of factors which come in, but baseline would be a good anterior chamber depth is the hallmark, and then an open angle and non-occluded angle. Once these two are there, you can go ahead and do the surgery. Rest all you can fit in.
Sir, currently ophthalmic community is transforming from diffractive optics towards refractive optics. Sir, why is that the case?
See, diffractive optics, it's a up and down roller coaster. The first lenses, multifocal, were refractive. They failed miserably because at that point we were not aware of what all is possible, what are the first order, the second order aberrations, the Zernike polynomials and the higher order aberrations coming in. So then we shifted to the diffractive ones. Now, diffractive was very promising. It has held its ground. Still, there are a lot of diffractive lenses which are working now. But it came with another set of issue. It came with, because diffraction by principle causes troughs and crests. You know, there's a negative subtraction of the wavefront and a positive addition of the synergy and antagonist. So you get the first order, second order, third order. And between the first order and the second order is the amount of light lost. That's the area of blur. So as science is moving forward and as the various options are coming back in again, opticians and optical scientists are realizing that there could be another trade-off where you can maybe promise better quality vision with less light loss. So that led to concept of EDOFs. And that's when spherical aberrations started coming in. So some smart scientists said, why not combine EDOF with diffractive? Why not combine spherical aberration with refractive? So you started getting hybrid lenses. Then some scientists said, why not talk about pinhole lenses? Wavefront modifying lenses. So these are all bifurcations. A lot of science is happening there. A lot of lenses are performing well in a few patients. The other lenses performing well in other patients. If you actually ask me, an ideal lens will be an accommodating lens. Till that happens, we are all work in progress. Because you are always playing with bending the light rays. And whenever you bend the light rays, there is some loss of light.
So, sir, as far as ophthalmic community is concerned, so there are a lot of collaborations between doctors and manufacturers. Sir, how can manufacturers add more value and collaborate with doctors in a better way for the future?
You see, this happens a lot in West. There are a lot of multinational companies who are heavily set right with the doctors and work together as a team. Now, this trend is now slowly catching up in India. But a lot of good Indian companies are actually tying up with doctors and sharing data, giving them optical bench systems. I myself, I work on Tracy machines and all that stuff, give the MTF values, the point spread functions of different lenses, effect of pupil size, everything. So once that collaboration happens, that's when we are looking at a lot of good products coming. And that is the result why a lot of Indian companies are making international quality products now. And for last couple of years, some of the lenses manufactured in this country, IOLs, are as good as the best in the world. Similarly, some of the phaco machines manufactured are excellent machines, very good machines. I personally have worked with a lot of Indian companies in helping them design their hardwares, their softwares on phaco machines. So this collaboration is happening now and it is showing results.
So, sir, let's sum up the podcast with my last question. What will be Dr. Kamal Kapoor's life in one sentence?
I would say never born, never died, visited planet Earth.
Damn, sir, that was a good of an answer. Like, it's like when birth is not in your control, death is not in your control. How can the life be in your control?
So I am just a visitor here.
Oh,
So that's why I said never born, never died, visited planet Earth.
visited planet.
Because I don't know where I'm going after this. I'm here on a visit.
Thank you so much, sir.
Welcome.
I have really learned a lot from you.
Thank you.
I really learned.
Thank you.
Thank you so much.